Hey guys, welcome to another edition of the Right Way Wednesday. So today I'm with Bernice Galvez Soto, and if you've been around with us, I guess any this year, hopefully you saw back in January, Bernice did a great special series for us of blogs or vlogs that went through the steps of QAPI. And if you haven't heard that term before, Bernice is going to talk a little bit about it today, so hopefully you'll learn a little bit more about it. You can go back and listen to that series, but it really is starting to become a hot topic. So you've probably heard people within your facility talk about it or within your organization, and you certainly, if you're with Healthcare Heritage, you've heard us talk about it as well. And Bernice has been teaching us. She is our resident QAPI expert, and she has been teaching not only you guys about it, but the compliance department, us, about the process and the system and why it's so important and what kind of role we can play into it and in that process. And you might be thinking that as a clinician, I don't know what this has to do with me. This is my facilities thing. I don't really need anything to do with it. But first, we're going to talk about our role in a minute, but what is QAPI in general? Just like a down and dirty explanation of what it is.
Well, let's start by saying that QAPI stands for Quality Assurance Performance Improvement. Now, the whole goal of CMS when they created the QAPI system was to create a system or a procedure to improve the quality of care and the quality of life. So that's basically QAPI. It is a procedure, it is a system that a facility implements or adopts to improve current systems and improve and return the quality of care and services that they're providing to their residents.
Okay, so really it's just a quality improvement program of sorts.
Correct.
Yes, right? All right, so knowing that then as a clinician, and even if you're not a rehab director, how can a clinician, our clinicians every day get involved in QAPI plans or QAPI processes within their facilities?
Definitely. I did like the fact that you actually pointed out the rehab director. I do want to stress out to everybody that in order to be involved in QAPI, you don't have to have a leadership role at all. Mm-hmm. You could be a rehab director, you could be the PTA in the facility, you could even be part of housekeeping, and if your goal is to improve a current system that is going to affect the quality of care, you could be part of QAPI. Now,
so it's really a team
effort, very universal. Sometimes we don't think of certain things that can actually affect and improve. So I'll give you an example of how we could get more involved with assistant QAPI plans. And again, this is only an example. Your facility might have other areas that are going to be more patient-centered based on the patients that you actually serve. So let's take, for example, a get-up list. I think that when we were in the field, we were treating, we used to put or create a list of individuals that could be up and running for us for the therapy department as early as like 7:30. The nursing department would agree with us and say like, yes, we'll make sure they're ready and they're in your therapy department and by 7:30. Things do happen. Things start falling off the cracks. Certain systems don't stop working. And sometimes we start creating that push and pull effect where we start saying, well, I don't think the CNA likes me. They're not bringing me the patients. Or I think the nurse department, they don't want to help us anymore with this get-up list. We get frustrated, and rather than finding a solution, we have to be kind of like the better person and say like, what's going on? And that's kind of an approach of a QAPI plan. You could actually reach out to the nursing department. If it's not your immediate leader, actually going to the nursing department and saying like, we have noticed that the individuals that are in our get-up list are no longer coming to our therapy department at 7:30. Now it's like 30 minutes, an hour delay. Is there something going on?
Right, let's figure out why
exactly.
Together. Yeah.
And, there could be different reasons. One could be an overturn of CNAs in the facility. Secondary, it could be that, there was probably a management change and now this person is holding other expectations for the current CNAs and nurses in the staff. It could be that actually even the get-up list hasn't been updated.
Right.
So it could vary in different ways. And I think one of the biggest things that CMS does great about QAPI is they have their own section and you can find tools. So as you're exploring this, and yes, there might be a small conference made or a small get-together and people start arguing like, I don't want to do this, I don't want to do that. You could use some of the tools that QAPI actually has. Some of the tools actually center in, for example, in the middle, you put the actual problem, which the problem here is the get up list. And then there's like the kind of like the fishbone where you have this line that corresponds to the DON, this line that corresponds to therapy, and see what each role can make a change so that it leads to making sure that we're providing the care that we're aiming to provide for those residents.
So those tools that you talked about, and I have seen those, they really just sort of help to facilitate that team discussion, right? Because at the end of the day, the whole focus of, well, I mean, what we do all the time, but the QAPI plan in particular, and anything that's on that plan is to improve the quality of care that we're giving to our residents. And so, we do have to work together and find a way to do that. And that's I've seen those tools. I think they're great for those kinds of discussions. So that's great. And it can, you mentioned the get up list and just, being able to get up and get to therapy, which they will need. But I mean, it could also be maybe being involved in, as clinicians, we're sometimes more in tune to details that might do things like increase fall risks, right, within your community. And so you might notice something if you've had an increase of falls or any kind of falls at all in your community. You might be the person that is, I think, best in position to maybe provide some guidance as to maybe helping identify what the problem is and then put some processes in place.
And that actually can lead for something successful, actually having a fall prevention program on that department. And, aside from even that, and one thing I do want to mention is not all QAPI is therapy related. I think as we build relationships and partnerships with our partners, we are also that outside eye that comes into the facility. And what I mentioned is many times the regular staff from the facility, so administrators, nurses, CNAs, they tend to see things as normal, but us, as we're coming from the outside and probably going to other facilities, we might walk in the facility and we might actually realize that there's a strange odor in one of the wings. And we might not take into account that could be an issue, but it is sometimes an issue that could be kind of a QAPI system or process that can be implemented.
Right, and those other team members who are there every day, what's the term, nose blind? They've gone nose blind, yes.
Exactly.
Yeah.
So that's actually another beauty about QAPI, that we are those extra eyes that might say, I noticed this strange smell when I walked in, and once they look further into it, they might actually know it and realize it's a pipe issue. They might actually realize that it could be even linen that is stored in a room, and that is actually not healthy for, again, our residents, because by the time that is clean, provided to them, there could be mold already being created. So it's different things about QAPI that we can actually assist as clinicians. We walk in those facilities. I think in the end of the day, like you mentioned, is a lot of collaborative work, and the main goal is here to improve our services and to provide the best that we can for those people we're serving.
Right. So I mentioned resources, or I mentioned the videos that you did back in January that you can still get to. Just kind of scroll down, or you can do a search within our page for QAPI, QAPI. Not QUAPI, which is how I was wanting to spell it at first. Do a search for that and you should be able to find those videos. But there are other resources too. I know you've done a couple of podcasts for our Compliance Connection podcast. If you haven't subscribed to that, go check us out. You can get it on iTunes and you can get it on other platforms as well for Android. And Melinda may be able to comment on this, and she's probably going to get me, but I can't remember for the life of me what that's called, because I am an iPhone girl, and right now I just can't think of where to go for that. But if you have an Android, so you can go grab it there. But what are some other resources our clinicians can go to get more information about not just what QAPI is, but the steps that are involved and how they can be involved in
the best resource or the best website that you guys can access related to QAPI will be cms.gov. Under the search box, you will go search for QAPI, QAPI, and it will take you basically to their entire dashboard, or what I call myself now the QAPI department. You have an overview. You have the 12 steps to QAPI, what is QAPI, how to assist in QAPI, how to even implement QAPI. Aside from those, you have a whole bunch of tools and templates that you could actually print. one of my favorite tools and that I invite everybody is actually the QAPI assessment tool. This is a self-assessment tool. All you do is just do a check mark and see where you stand on knowledge on QAPI. And I think it's a great start because you might not realize that one of the questions there says like how knowledgeable and you are on policies and procedures. You might actually, being honest with yourself may say no, just because you might not even know where to access that. But that is something that also relates to QAPI. So it's a cute and quick small assessment, self-assessment to know also how much you can get involved with the QAPI, or even to trigger that that urge to get involved in a QAPI program. So
Right.
CMS.gov has all the resources related to QAPI that can assist you with any questions and concerns. And obviously, our comment box below, you could ask for specific questions, or like Nicole just mentioned, here in our Facebook documentation successful page, we have done videos on the 12 steps of QAPI, as well as what is QAPI, and there is also podcasts related to QAPI. So
Lots of resources.
lots of resources, correct.
Okay. Thank you so much,
No
Bernice.
problem.
I appreciate it.
Thank you.
As she said, let us know if you have any questions in the comment box below, or by shooting us a private message or a direct message just on Facebook. We appreciate your time. Thanks so much, and happy documenting.